You might not be familiar with this disease, but it's silent and deadly. It's a virus called Hepatitis C. It can hide in the liver and slowly damage it over many years without getting noticed. Over time, it can lead to liver cirrhosis or cancer. Hepatitis C affects people all over the world. It is more common in developing countries, affecting 2 in 100 people. With advances in medical science, we now have medicines to cure this dangerous disease. Let's ask Dr. Smart about it.
Hello and welcome. I'm Dr. A from Smart Clinic. Let's talk about hepatitis C today.
Dr. A, how does hepatitis C affect our body?
Hepatitis C virus enters our body through blood and settles in the liver, making the liver its battleground. In 1 out of 3 people, the immune system of our body will fight off the virus and hepatitis C will be gone for good. But in others, the virus uses special features to stay hidden while it silently continues to damage the liver. Since the damage is slow, many people will not develop any obvious symptoms. This is why many times hepatitis C is diagnosed many years after the infection is acquired. The severity of liver damage can be different in different people. Almost 1 in 4 people will have progressive liver damage and excessive scarring. This condition is called cirrhosis. Long-standing hepatitis C is a common cause of liver cancer as well. By doing blood tests, we can check if someone has hepatitis C. Doctors should recommend screening tests for people who are at a high risk for developing this infection.
What happens when a person develops liver cirrhosis?
Liver cirrhosis can be caused by hepatitis C or other diseases that slowly damage the liver over time. Other common causes of cirrhosis are alcohol use, hepatitis B infection, and fatty liver disease. Cirrhosis leads to many problems. First, the liver is not able to manage energy stores of body, which causes muscle loss, fatigue, and low appetite. Second, the blood becomes thin due to less platelets and clotting factors. This can result in easy bruising and bleeding. Number 3, the eyes and skin can develop yellow color due to high bilirubin level in the blood. This also changes the color of the urine to dark orange. Number 4, as the liver is not able to clean the blood properly, the toxic and harmful waste can accumulate in the body and can make a person drowsy or confused.
I'm Pietro Andreone from the University of Bologna, Italy, and I'm here to present you about a study evaluating the efficacy of treatment with antivirals in subjects with chronic hepatitis C. The study is named PEARL 2 and included 3 direct antiviral drugs with or without Ribavirin. The 3 drugs are 4,5-O ABT, that is a protease inhibitor, Ombitasvir, that is a NS5A inhibitor, and Dasabuvir, that is a NS5B non-nucleoside polymerase inhibitor. This study was performed in 186 subjects with chronic hepatitis C receiving a 12 months treatment. The key inclusion criteria were age between 18 and 70 years, the absence of cirrhosis, and a previous non-response to pegylated interferon and ribavirin. The key exclusion criteria were co-infection with HIV or HBV and genotype different from 1B. The efficacy endpoint were sustained virological response 12 months after stopping treatment, non-inferiority and superiority sustained virological response compared to an historical control group of subjects treated with telaprevir, pegylated interferon, and ribavirin.
So hepatitis C treatment demands that we assess patients for readiness. When I was working in the hepatitis C clinic at the VA last year, one of our main duties was to assess patients for readiness for treatment. So the provider might select them, but then we needed to do a phone call. And we were involved as pharmacists in that phone call because some of the readiness talk is drug-drug interactions, and then also adherence. So we went through their history, adherence to medications, do they have adequate psychosocial supports to get through the treatment regimen. We've taken away interferon now, so it's not as demanding of a treatment, but it still should have support. Are they psychiatrically stable? Also not as important without interferon, but something that we took into account. And then, as Dr. Zaman mentioned, drug and alcohol always should be evaluated and addressed before starting treatment. There are 3 things, I've already mentioned one, that have to be taken into account when choosing a treatment regimen for hepatitis C. First one I said was genotype, so 1 through 6 genotypes. Second one is prior treatment exposure. So has the patient had treatment with interferon or any of the ones that came out prior to 2013 and did not get an SVR when they were treated with that. And then finally, fibrosis status, have cirrhosis or not. And these things will influence both the regimen that we choose and the duration of the regimen, so how long they're on the therapy. Because of these factors, I can't go through every treatment regimen with you because obviously there's going to be a million. So we're going to talk about just patients that have genotype.
The regimen is the 3 direct-acting antiviral regimen, which, as you heard previously, includes ABT 450, a NS3/4A protease inhibitor, boosted by the HIV-1 protease inhibitor ritonavir. It is also co-formulated with Ombitasvir as a single tablet. Patients also took Dasabuvir, a non-nucleoside The regimen is the 3 direct-acting antiviral regimen, which, as you heard previously, includes ABT 450, a NS3/4A protease inhibitor, boosted by the HIV-1 protease inhibitor ritonavir. It is also co-formulated with Ombitasvir as a single tablet. Patients also took Dasabuvir, a non-nucleoside NS5B polymerase inhibitor taken twice daily, as well as Ribavirin. Prior to initiation of the trial, there was extensive phase 1 drug-drug interaction studies conducted in healthy volunteers with tenofovir and tricytidine atazanavir that indicated no clinically meaningful changes in hepatitis C or HIV drug exposures. As you previously heard, the 3D regimen with or without Ribavirin has been studied in more than 2,700 patients with high rates of sustained virologic response. More than 96% of those who are treatment naive and treatment experienced without cirrhosis for 12 weeks, and 92 to 96% in cirrhotic patients treated for 12 or 24 weeks.